Well, sometimes it is tough to decide when to take kids to the ER or just take them to the emergency care facility near your home. If your child needs to be seen right away, it is important that they're evaluated by a pediatric physician. CHKD provides the only freestanding pediatric emergency department trauma center in Virginia, and here to talk more about that today with us is Dr. Paul Mullen. Thank you so much for joining us. I apologize for the pause there, but
no problem.
We're just discussing a little bit about, what the benefits are of an ER, a pediatric ER specifically, versus an urgent care. So how can a parent decide when their child is injured?
Yeah, Andre, great question. It really comes down to a few different options. So I have a 1- and 3-year-old, and unfortunately they've had to go to an emergency department. They've also been to the urgent care clinic and their primary physician. I really think those are the real 3 main locations if your child's acutely ill or injured where you have to decide where to take them. For us, the decision really came down to timing. So some of those locations might not be open at the right time or the time of day. It might be Sunday afternoon and everything's closed. That would be an emergency department. If it's in the middle of a Monday, perhaps your primary care office is open. So timing is one thing. And the second thing really is how acutely ill or injured is your child. And that really is a gut check for yourself as a caregiver or a parent to figure out, is my child so ill that they need an emergency department, or is this something that perhaps an urgent care center or my primary care physician can help handle? But
specifically, you would say have them see someone that specializes in pediatric care.
Definitely. Somebody who sees children all day long. They're going to be the best people to figure out how to examine your child in the right appropriate way, how to handle them in a child-friendly atmosphere, how to figure out what are the best tests we need, if any are even needed at all, and then finally what's the best treatment so that we can get your child better in an expedient manner.
So, we talk about the benefits of taking the child to a pediatric ER, and one of them is the child-size equipment that you have that an urgent care might not have because they'll mostly cater to adults. Talk a little bit about that. What kind of machines would you have that specifically for kids?
Sure. So machine-wise, some of the urgent cares will have some of the pediatric equipment available, but a pediatric ED will really have all of the services, all of the equipment that's needed. From a radiation standpoint for CT scans, our CT scanners, when we do need them, and we use them as infrequently as possible because we do want to limit radiation, but you're going to be getting the child-sized dose of radiation to really limit any harm.
So we talked about some of the items that you would have. What's CHKD's department? What do you guys offer to treat children that are ill, and what kind of illnesses? We have about 20 seconds left.
Perfect. The big thing really is expertise. So we have more pediatric emergency medicine trained physicians than any other emergency department in Virginia. We're the only freestanding children's hospital, as you mentioned, with a trauma center that handles the highest level of trauma care available. And really that's going to give your child the right care at the right time.
All right, Dr. Paul Mullen, thank you so much for joining us. So the bottom line is there, if the hours are right, try to get your child in front of a pediatric physician before an urgent care if you can. All right, thank you so much for joining us today.
Thank you, Andre.
And more information, by the way, on this on our website, 13newsnow.com, and we will be right back.